No? Okay. Well, here we go. Having some technical difficulties on Instagram, so I am just going to do it on IG today or Facebook. Okay, never mind. Hello. Happy Tuesday, everyone. Morgan coming to you live for a Talk About It Tuesday. And if you are pregnant or nursing, this Talk About It Tuesday is for you. So today I will be talking about what ingredients you're going to want to avoid while pregnant or nursing. So I have a ton. There is something in this COVID water, I tell you. It's probably because we're all home. We're all bored out of our minds. We really don't know what to do with ourselves. And so we look at our partner and we say, hey, you, me, you, me, you, me. And, we make babies, right? Or you guys make babies. No babies are happening here. No babies. So I have a ton of friends who are pregnant or have had a baby and are nursing. And I could not be more happy for these ladies, over the moon for these couples that are procreating. I will not be. But talking today about what ingredients that you're going to want to avoid while pregnant or nursing. And listen, I'm not a doctor. I always say that. I don't play one on TV. I'm not even trying to be like the end all be all. My opinion is that most skincare ingredients are not a small enough molecular size to go into the bloodstream. However, skin, as I've often said, is our largest breathing organ. So, with that being said, things are going to get absorbed. Things can slip through the cracks. Our skin does absorb some of the ingredients and nutrients from products and etc. So, will these ingredients necessarily harm your baby? Guess what? Doctors don't even know because they have not done tests or trials to decide if that's going to be the case. Okay. Who wants to test anything on a pregnant woman? No one. So, but these are ingredients that the healthcare world, skincare world has said to avoid for various reasons. Okay. So the first very, very common one are retinols or any form of vitamin A, which can be retinols or salicylic acid or even benzoyl peroxide, which is not a form of vitamin A. But they definitely recommend to avoid these retinols or salicylic acid, which are two of the most common, because it can thin the skin. Salicylic acid has been shown to get into the bloodstream, again, probably very minimal amounts. And I think it's one of those things that again, they're not gonna test that on a pregnant woman, right? So you want to avoid retinols, salicylic acid, benzoyl peroxide. Those are kind of the most common ones. Another ingredient or product that you want to avoid is hydroquinone, which is the prescription strength bleaching skin agent. This can get into the bloodstream. So you just want to protect that little baby that you have growing inside of you, that little alien, or if you are breastfeeding, same kind of thing. It can get into your bloodstream, it can get into your milk, it can get into the baby. So some questions I've had is about, like vitamin C. Vitamin C is one of those, it's not a total avoidance, but you may want to cut back on vitamin C and any chemical-based sunscreen. So maybe while you're pregnant, just sticking to those physical sunscreens is going to be the best option for you. So just a couple of quick ingredients that you're going to want to avoid. Again, to recap, retinols, so your retin-A's, your retin-A or anything with retinol, like Image Skincare, which is the skincare line I use, they have a retinol cream. Anything that has the word retinol, retinoid, vitamin A, you're going to want to avoid. Salicylic acid, benzoyl peroxide, hydroquinone, which you shouldn't really be using anyways because it's not the best thing to, it definitely is strong. It can lighten your skin, but it has been shown to lead to cancer and things like that. But again, everything in moderation, right? and chemical sunscreens. Again, I am one of those that says this is not going to get into your bloodstream. So if you use it once, don't freak out. It's just if you're using it repetitively and you're using large amounts of it, and again, no one wants to really test things out when they're pregnant. So those are some things to avoid. Now, what you can do alternatively, if you're having some type of skin issue, or maybe you're breaking out and you're like, oh my gosh, my skin is so hormonal, it is going crazy. I want to slap some salicylic, some benzoyl peroxide, some retinol on there to help with my breakout activity. Hello, maskne. Some things that you may want to look into would be a purifying probiotic mask. So this is the Image probiotic mask, and I've talked about this a few times on my channel, but a good probiotic clay mask. Clay is going to help absorb any of the dirt, debris, and oils in your skin. If you are not traditionally acneic, again, do not apply a clay mask all over your skin, because the rest of your skin will hate you and it'll start to dry out and get dehydrated, and we don't want that. Or more dry out, not really dehydrated. But this is a great probiotic balancing mask. So a clay mask, some probiotic skincare is great. Taking a probiotic will be great for you and your baby. Again, I'm not a doctor, so always ask your doctor if you are going to add a new vitamin to your regimen. But a topical probiotic mask is a good alternative if you are experiencing those hormonal breakouts and you want to just slap some salicylic or retinol on your face. Trust me, I get it. I know. I've not been pregnant, but I want to sometimes slap on some salicylic acid to spot treat. So that's a good alternative if you are pregnant. Some other good things to add to your arsenal would be a hyaluronic acid. This is not an acid, it's just called hyaluronic acid, which is found in our body. But hyaluronic acid is a great hydrating ingredient to add hydration to the skin. You are drinking for two, and it better just be water. But your baby is going to absorb a lot of your nutrients, ladies. So you want to make sure you are packing your skin and your body with extra nutrients, because you're doing it for two now. So hyaluronic acid is a great ingredient to add, just because you are probably going to feel very dehydrated in your skin because that baby is sucking everything out of you. Another one is a good antioxidant serum. This is the Ormedic Balancing Antioxidant Serum. These are all Image products, but this will help protect your skin from free radical damage, sun damage, environmental damage, etc., which will just in turn protect your baby even more. So those are a couple of great alternatives for your skincare regimen. But again, you want to avoid retinol, salicylic acid, benzoyl peroxide, hydroquinone when you are pregnant or nursing. So hope that helped. Protect you, protect your babies. Everyone have fun making babies. I mean, there's really nothing better to do during this time, right? And if you are looking for someone to help you during your journey of pregnancy with safe, great skincare, I am your girl. I do microdermabrasion and dermaplaning, which are both completely safe to do on someone who's pregnant or nursing because there are no chemicals involved. So if you're looking for a treatment to treat yourself and your skin during your 9 months of pregnancy bliss and the years after for either relaxation, mommy time, or whatever, let me know. You can DM me, text me, call me. Everything's in my Instagram profile. But I hope that helped. You guys have a fantastic day, and I will see you next week for another Talk About It Tuesday.